I'm going to go ahead and get started. Welcome to session 8 of the 20th annual Northwest Interlibrary Loan and Resource Sharing Conference. NWILL wishes to acknowledge the territory called North America, now primarily occupied by descendants of European colonizers and other immigrants, is rightfully the land of Indigenous Native American and First Nations populations. We are all responsible for understanding the history of the colonization and genocide of Indigenous people and must continue to learning, building relationships, sharing stories, and taking action to support the Indigenous sovereignty, priorities, and actions. We encourage you to learn more about Indigenous peoples to whom the land you that you occupy rightfully belongs. Please visit the document sections in the conference platform to learn more. Today's date is September 2nd, 2021. This session is titled Own versus Borrow, the Meaning of Access, and will be presented by Danielle and Marta, both from New York Medical College. My name is Pam Kindelberger, and I am the convener for this session. This session is being recorded with the permission from the presenters. They retain the copyright information they are presenting, and they may request its removal from public viewing for future by writing a request to the NWILL committee chairperson. However, at this time, it is planned that recordings will be available once captions have been added. Attendees will be notified as soon as they are available. To turn on live captioning, click CC at the bottom of the screen and select Show Subtitle. If you have questions during the session, please use the Q&A function in Zoom, and I will pose these to the presenters at the end of their presentation. The door prize keyword will be revealed between the presentation and the questions and answers. Please visit the door prize link in the Event Mobi menu. When Zoom webinar ends, please complete the one question post-session survey in the Event Mobi located at the bottom of the session page. On that note, I will turn the session over to Marta and Danielle.
Hi, everybody. Thanks for that, Pam. Appreciate being here, and everybody for joining us to discuss owning versus borrowing and the meaning of access to library resources. I'm just going to turn off my camera now. All right. So for our agenda, we'll talk a little bit about the New York Medical College. We'll go over the ILL services and beyond. And then Marta will talk about how we chose ReprintsDesk. And then we'll talk about how we implemented that into our EDS and changed ILL from a service into a resource. So a little bit about New York Medical College. New York Medical College has been around for about 150 years, but in 2015 we were subsumed under Touro College and University systems, and we're located in beautiful Westchester County, New York, just outside of the city. But we remain an independent institution, so we have our own budget and we do our own purchasing, which is really great because Touro is nationwide, and actually I think they're international now. So we remain independent. And after an extensive weeding process of our physical journal collection, we now have just over 26,000 volumes in our collection. And we maintain over 43,000 electronic journals and books. And of course, that's because students want study space, and the library is the ideal spot for that. So we were asked to rearrange the library, which has worked out really well. We have a library staff of 18, which is, pretty robust. That includes 14 librarians and 4 support staff. And we are the cornerstone of the commitment to the services and the outreach to the NYMC community. So we provide all the services for faculty, researchers, the clinicians. We've got our jobs cut out for us. ILL service and beyond, we're looking to provide more options for our users to get the resources they need. When journal titles are cut, due to budget decreases or just the cost of the journal itself, the question is, how do we get those articles to the patron that we used to own, but now we don't? And then we're asking them to get to go through the ILL service. But was there a better way to do that? Sometimes those are journals that are core to a certain department, anatomy or anesthesiology. But if they're a small department and they're not getting used a lot, how do we justify spending the money? And so while at the same time, getting the user what they need without that extra cost and without the multi-layer, in the ILL system, they have to now go to the ILL system and retrieve that article. So we were looking for different ways to enhance our services and make it more of a resource. So we all know journal costs are rising, especially within the medical field. Journals costs, sometimes up to tens of thousands of dollars. And our budgets, of course, they may not be cutting them, but they're staying even, right? So we're not getting those increases we used to get, or necessarily getting what we're asking for. They're asking us to reduce our budget. So when we look at what the cost per use is, that's how we decide, right? So before we had a major budget cut, our cost per use, which is right, one article, how much does one article cost a person to use, or cost us for that person to use? So it used to be at $55, which is sort of high when you consider, when you look down, like ReprintsDesk sort of average cost is $45 when you break it down, right? So it was pretty high, and we lowered that to $35 for one use. And then when you look at the average cost of an ILL, it's just under $5, not including royalty fees or copyright fees, and it could take some time to get. So if it's an urgent needed article, they're not going to get that right away. And then again, with the average cost of ReprintsDesk being at $45, where does that fit in? And it actually fits in two good places within the collection and within ILL. And then the article is sent directly to the person, so they don't have to go to another system to retrieve that article. They order it and it comes to them, and it's sort of seamless. And Marta is going to take over and discuss how she chose ReprintsDesk and the workflow around that. Marta?
Yes. Since budget cuts and journal cuts that Danielle mentioned, Interlibrary alone became a crucial service for a New York Medical College community. And I would like to mention a little bit more about the average of cost of interlibrary loan, because when we started to look our collections, when we started to look into cost per use, we also started to look at how much is ILL service. And in particular, we started to analyze how much is to provide ILL request. And we factor in all expenditures that go into interlibrary loan, like software, like royalty fees, like fees that we have to pay to other libraries, and even shipping of the books, the cost of the shipping of the books. The question remained, can we do better? Meaning, can we provide the service within our cost limits, but even more seamlessly and within expected turnaround time. About the same time, I was introduced to ReprintsDesk during one of the ideas conferences, and what we started to do is to started to compare our paying royalty fees through a copyright clearance center and traditional ILL, and cost of the request through ReprintsDesk. And here is what we found out. So first of all, when we have to pay royalty fees, when we go through traditional ILL and we pay royalty fees through copyright clearance center, sometimes we have to pay those royalty fees in addition to ILL charges, and there is no way to predict or whether or not the article will be available ahead of time, whether or not article will be available free of charge, or we have to pay for it. With ReprintsDesk, there is no surprise. There is one charge, and we know ahead of time, which was very important for us since we wanted to stay on a budget and we wanted to plan. We wanted to factor in the price, and we wanted to know this price ahead of time. The process through traditional ILL and copyright clearance center sometimes takes time. We provide most articles within one day, but there are times that we need 4 or 5 days to provide the article, and again there is no way to predict how much time it will take. With ReprintsDesk, article is available within minutes, and it's sent directly to the patron. So there is no extra processing, no extra staff time that is required here. From administration point of view, the tracking and billing process of copyright clearance center is sometimes time and labor consuming. Again, staff time, meaning my time. With ReprintsDesk, billing is very straightforward. I just receive invoice on monthly basis, and after reviewing it, we just pay, and that's the end of it. The billing on monthly basis again help us to stay on a budget and plan for the expenses. And the next slide, please. We also considered implementing Get-it-Now into our ILL workflow. However, this feature needs additional annual and implementation fees, and as a good stewards of the university, we chose the system that doesn't require additional fees. So there is, with ReprintsDesk, there is no additional cost other than paying for articles, paying for the field requests. Next. Before I will talk about implementing ReprintsDesk into ILL workflow, let me highlight key ILL policies that let us to containing cost and yet fill the request within the time frame they are expected. Again, in the medical field, this turnaround time is very, very important. First of all, since 2015, interlibrary loan and document delivery service is free of charge for New York Medical College patrons. We decided that the library absorbs the cost of document interlibrary loan, including royalty fees, and we set the maximum cost that library absorbs the cost based on patron status. So we pay up to $15 for students, $35 for residents, and $50 for faculty. And we determined this best price comparing various options. In addition, when all sources of traditional ILL are exhausted, we still consider buying articles through ReprintsDesk as long as we stay within the maximum cost I mentioned a moment ago. And next slide. So in a nutshell, incorporating ReprintsDesk into ILL workflow looks like this. First of all, we follow mediated workflow, meaning that all decisions are made by our ILL staff. And we made this decision because simply because we could do it. We have full staff, that full-time staff that processes just about 300, on average 350 requests monthly. So we have manpower to go with mediated workflow. If we do have to pay royalty fees, we compare fees between Copyright Clearance Center and ReprintsDesk, and basically we choose better price. If we don't have to pay royalty fees, but we cannot fill the request through traditional ILL, we follow maximum cost policies and still consider ReprintsDesk. And I will go to the next slide, and I will tell a little bit more about this workflow. So we received interlibrary loan request, and we determine whether or not we have to pay royalty fees. And if royalty fee is required, we either fill it through traditional interlibrary loan and pay royalty fee through Copyright Clearance Center, or we order the article through on patron behalf through ReprintsDesk. If no, too fast. If the request doesn't need royalty fee, we either fill the request through traditional ILL, or if the request comes back unfilled, we follow our maximum cost policies and we consider ReprintsDesk. Now, next slide, please. Next slide, please. So far, I discussed interlibrary loan as cost-effective service. But being cost effective is not enough for us, was not enough for us, is not enough for our patrons. The very important factor here is our patrons need rapid and seamless access to the materials. And as we mentioned before, mediated interlibrary loan process is cost effective, but it takes time. And when we faced, yet again, journal cuts, the question remained how to make administration happy and stay on a budget, and how to keep patrons satisfied and fill the request within time frame it's expected. The question came to us for further discussion was, do we want to incorporate unmediated interlibrary loan? Or do we want to implement ReprintsDesk into our EDS system? When we analyze unmediated interlibrary loan, we came to two conclusions. One is from the staff perspective, we lose control over cost, and we possibly face over ordering, overcharging, and we really were concerned about that. But even more importantly, from patron perspective, the process seemed to be not very clear, since patron would come to the same platform as traditional interlibrary loan, but they would get the article differently, and they would never know how fast they will get the article. Therefore, we decided to incorporate ReprintsDesk into EDS, and Danielle will talk more about this process.
Thanks, Marta. All right. So as Marta mentioned, ReprintsDesk had contacted her during the IDS conference in the summer of 2019, and they said they were working on this project, having the ReprintsDesk app within the EBSCO Discovery Service. So that's what I handle. So Marta gave them my name, and they contacted me in October, to see, test if we wanted to be one of the first people to implement this. So, we thought this is a great opportunity to see how we can do sort of a mediated, unmediated, right, access. The process was long. We started it in November. It actually wasn't even completed until July of 2020. Yes, it was a lot of Zoom calls, a lot of emails back and forth. We had EBSCO, ReprintsDesk, and myself, working out, customizations, making sure that things were working properly. Of course, you don't want to just put anything out there that isn't working. So it was a lot of testing, adding journal titles. How does this work? And so we have just over a year's worth of data. But what I'm going to talk about first is, how do we come to decide what journals are we going to include it as this within the app in the EDS. So we've been cutting titles since 2018, whether it's the cost per use or it's budget cuts. We've cut 32 titles, probably a little more than that, but maybe not all of them, needed to be included within ReprintsDesk. And that was at an estimated cost of saving the college over $150,000. And when we evaluated the actual use of the journal articles, right, within the journals, like if only 6 articles were used, we times that by the average cost of the specific cost of the ReprintsDesk price, right? So it came out to just about $80,000, which, sounds great, right? It's a potential savings of $70,000, so we right away after it was implemented, but and when you look at the actual use, it's extremely low. Only 29 articles were ordered out of 32 titles that were in there, with a cost just around $1,000, right? And then interestingly enough, 28 articles from those same 32 titles were ILL requests, were at zero cost. Well, maybe more at as little cost, but when you look at the sheet, there's no extra, library fees or copyright fees or any extra costs in that. So they were essentially free. And it actually cost $1,000 for those $150,000. So did we save the college an actual $149,000? I think we did a pretty good job. And I'll show you sort of, this is how we determine, right? Like, so these are our titles to be cut, right? So they're all over the $35 limit, right? So this is cost per use is 6 uses. This is the subscription cost, right? So this isn't real, just to be clear. And it may look funny, but there is something in here that's of note, which is this cancer one, right? So there's a lot of articles requests for this, right? Interesting. But it is over the $35, almost hits our $55 mark. It is expensive, right? Even ReprintsDesk is up $51. And it's just about $70 more for ReprintsDesk than it is for the actual cost. But when you look at the cuts itself, right, you're still saving $9,000, $10,000, just about $9,000. So it was something, to consider. And it's like, well, let's just see what happens, right? How are users going to use this? And then when you look at the actual, right? So these are the actual ReprintsDesk requests. This is the cost of what the ReprintsDesk is. And then you times that. So the cancer actually, oh, go back one. Don't click the thing. Nobody even ordered a cancer article. Now, how can this be? They didn't even order an ILL. Now, it's hard. Sometimes it's hard to judge because there's certain professors that like certain journals for classes, or there's a research project the researchers are working on. So it changes with any given year who's actually using articles. But if you look at the anesthesia one, right, we still had 15 requests, but it's way under the subscription cost. But plus there were these 4 ILLs for that same title. So in the end, it really just cost us $664 just for these specific titles, right? Which is a significant savings. If you added all this up, it's going to be quite a bit more. And this, and now I'll just talk about how to incorporate it, the ReprintsDesk app, into our EBSCO discovery service. This is our back end. And they have a custom package that they create, and you can add that to your collections. And, I wish I could do sort of live, but it's kind of hard. So you search your title, the title that you want, like if I wanted Acta Neuropathologica, right? That has to be my first one that I can't pronounce. You search for that title and you click on, add to custom package, and then you choose your ReprintsDesk package, because they have bunches of different packages. Apparently now they might be adding more different types of reprint article services into here. And then you add it into here, and then let me get to the next one. So when the user is searching, if they're looking for this article, right, this is our full text finder we call our NYMC access button, and that's across all platforms. So it's in PubMed, it's in Web of Science, it's in Ovid. So no matter where they search, this is an EDS search, but no matter where they search, they'll see this NYMC access button, and it will take them to this second intermediary page, which will have full text finder results. Where can this be found? And we chose, this is all customizable. So we chose to keep the interlibrary loan link first, right? Most people know what that is, and they're familiar with it. So we didn't want to encourage them to use ReprintsDesk, but we wanted there if they have to have, right, direct delivery, digital delivery in minutes, right, from ReprintsDesk. And they put in their email address and they place the order, and then within a few minutes, they'll get it right to their email box. Now, within this, we had to give them a list of domains that our community uses. And since we're affiliated with a few hospitals, it's not a long list, but there's a broad list of titles, of domain names that people, that we put in there so that they'll get the article and it's authenticated to our system. And as you can see from the previous slides, it hasn't been overused, right? People aren't abusing it. Why? The Cancer Journal had 62 articles downloaded previously and none now. That's something else to think about is, are people just clicking and like just getting the articles just because they can, or and then when they can, they're like, oh, I don't need that, or it's hard to determine what that is. So it's been, in conclusion, it's been very effective for us. It definitely saves money. It's definitely less staff time. Even though it took a lot of my time to develop that process within the EDS and Marta's staff time as well. I think in the end, once we have it all together, it'll work much smoothly. And then the patients, we think they're getting what they need. We're pretty sure. And if, please, any questions, or you can just contact us directly if you have anything further. Thank you.
Thank you, Marta and Danielle, for that really informative presentation. If you want to stop sharing before we start into questions, I'm going to go ahead and share the door prize slide so that people can get that before they go. So for all of you out there, this Idaho State Park was once a World War II naval training station. And the answer to that is Farragut State Park, and it needs to go in exactly as you see it on the screen. When you go to the Event Mobi page, you'll need to put that in the submit a passcode field, and then you can get credit for the answer for that one. So I will stop sharing, and I will share the one question that we have so far. What do you do for faculty articles that cost more than $50, especially medical journals? Some articles can cost up to $100.
Yes. So what we do, the library cannot absorb the cost of, we determined that the library cannot absorb the cost of more than $50. So what we do, we cancel that ILL request, but we do send the faculty member information how they can obtain it for themselves. Sometimes it's a matter of requesting that article through ResearchGate, contact the author, something that we feel that we cannot do on patron behalf, but they should pursue themselves if they really need the article.
Okay, here's another one by chat, or I mean, sorry, it came from chat, but it says by a traditional ILL, do you mean NLM's DocLine? And if you're not using DocLine, why not? It's $12 a request.
We do use DocLine, we do use Iliad, and we do use DocLine. But when they are instances that the article still comes back unfilled even when we post it. I mean, send it through Iliad, through OCLC, through DocLine, send begging messages on DocLine listserv. Sometimes it's just the article is impossible to obtain.
I'm going to throw myself out there for a moment and throw in a second half to that question, I guess. Is it sometimes hard to obtain because of embargoes?
It's probably because of embargoes. Probably sometimes it's very unique journal title. Our researchers have very how would say they are very specific of what they want. They do research on this very small portion of little toe of your left foot, and it's just you know we do try a lot, but again there's sometimes and it's another big percentage. But again, it happens.
Yeah, in the chat, Jen was saying it's those EPUB ahead of print too, right? Oh.
Yes, yes, those two. We have one faculty member who requests articles that were just published yesterday.
Mm.
But it was published. Yes, but it was published yesterday.
Yeah, I think we can all raise our hand to saying
yes,
we know that we've gotten that ILL. Or I've gotten the ones where it hasn't actually been published yet, but they found the citation that says it's in press.
Yes.
So it actually hasn't been published yet, but they still want it. But somehow the person who wrote the article got like a preprint because it was being written by their friend at another institution. Yeah, it's fun.
Yep.
Yeah. Okay. Okay. I don't want to step on Pam's feet, but I just wanted to say, are there any additional questions? I also know it's the last session of the day, so it's going to get a little quiet.
You guys can always email us.
Yeah. Do we have your emails? Or I'm actually
they're on the slides. Yeah, it was on that one slide.
Okay.
And somebody in chat did ask if the slides will be available today after the session. Did you guys upload your slides onto InventMobi?
No, I didn't know I could, but I'll do that today.
Okay.
I'll do that now.
Okay.
And if you can't, you can go ahead and email them and we can do it for you. So one thing I can say, InventMobi is very easy for us to do that. In fact, the conference is still going on and faculty already asking for the papers. Yep. Yep. Okay, if there aren't additional questions, I'm more than happy. I'm the tech person, so I'm more than happy to say that we can probably end a little early, but we do still have our social rooms are open for if people want to carry the conversation over and actually talk, and instead of having the talking heads.